Hello, my name is Catherine Smith. I'm an Indiana State University nursing student in the LPN to BSN program, and I'll be discussing diabetic foot care. The population at risk, or the PAR, are persons living in the United States ages 18 to 80 years of age. Learning objectives. You, the learner, will be able to state the different types of diabetes. We'll list the causes for the different types of diabetes. We'll identify risks and other health problems associated with diabetes. We'll be able to describe diabetic foot care guidelines, and we'll be able to use the resources to help educate. Please pause the video for a brief pretest. Click on the link below or go to this address. Both Healthy People 2020 and the World Health Organization acknowledge the need to address this growing health issue. Diabetes affects an estimated 30.3 million people in the United States and is the 7th leading cause of death in the United States and globally. The goal of Healthy People is to reduce the burden of diabetes and improve the quality of life for all persons who have or are at risk for diabetes. Per the CDC, diabetes is a chronic disease that occurs when the body cannot produce enough insulin or cannot respond appropriately to insulin. Insulin is a hormone that the body needs to absorb and use glucose as a fuel for the body's cells. Without a properly functioning insulin signaling system, blood glucose levels become elevated and other metabolic abnormalities occur, leading to the development of serious disabling complications. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is thought to be caused by an immune reaction. The body loses its ability to produce insulin. Risk factors for type 1 diabetes are not as clear as other types. Known risk factors include family history. Having a parent, brother, or sister with type 1 diabetes increases your risk factor. Age. You can get type 1 diabetes at any age, but it's more likely to develop when you're a child, teen, or young adult. In the United States, whites are more likely to develop type 1 diabetes than African Americans or Hispanics. Currently, no one knows how to prevent type 1 diabetes. Type 2 diabetes is a result of a combination of resistance to the action of insulin and insufficient insulin production. Risk factors include having prediabetes, being overweight, 45 years or older, a family history having a parent, brother, or sister with type 2 diabetes. Activity, if you are physically active less than 3 times a week. Having gestational diabetes or giving birth to a baby who weighed more than 9 pounds. Being African American, Hispanic, Latino American, American Indian, or an Alaskan Native. You can prevent or delay type 2 diabetes with simple proven lifestyle changes, such as losing weight if you are overweight, eating healthier, and getting regular physical activity. Gestational diabetes is a common complication of pregnancy. Gestational diabetes can lead to prenatal complications in the mother and child and substantially increase the likelihood of a C-section. Gestational diabetes is also a risk factor for the mother and later in life the child, as it has an increased risk of developing type 2 diabetes. Risk factors include having had gestational diabetes during a previous pregnancy, giving birth to a baby who weighs more than 9 pounds, being overweight, over the age of 25, having a family history of type 2 diabetes, having a hormone disorder called polycystic ovarian syndrome, if you are African American, Hispanic, Latino American, American Indian, Alaskan Native, Native Hawaiian, or Pacific Islander. Gestational diabetes usually goes away after the baby is born, but increases your risk for type 2 diabetes later in life. The baby is more likely to be obese as a child or teen and is likely to develop type 2 diabetes later in life too. Per the CDC, diabetes affects an estimated 30.3 million people in the United States and is the 7th leading cause of death. A diagnosis of diabetes increases your mortality rate by 1.8 times and increases the risk of heart attack. It is the leading cause of kidney failure, lower limb amputation, and adult onset blindness. In addition to these human costs, the estimated total financial cost of diabetes in the United States was $245 billion, which includes the cost of medical care, disability, and premature death. Daily diabetic care should include blood sugar checks. Check your blood sugar several times a day as directed by your doctor. Keep a record of your numbers to share with your health team during your next visit. Take your diabetic medication as prescribed by your doctor even when you're feeling good. Physical activity should include at least 150 minutes a week of moderate activity such as brisk walking or riding a bike. Include a healthy diet. Eat healthy foods that give you the nutrition that you need and to help your blood sugar stay at your target range. Diabetes can be dangerous to your feet. Even a small cut can produce some serious consequences. Diabetes may cause nerve damage, which leads to numbness, loss of sensation, and sometimes pain in your arms, hands, legs, and feet, which is called diabetic peripheral neuropathy. Diabetes may also reduce blood flow to your feet, making it harder to heal an injury or resist infection. Because of these problems, you may not notice a foreign object in your shoe. As a result, you could develop a blister or sore. This could lead to an infection or a non-healing wound that could put you at risk for an amputation. To avoid serious foot problems that can result in losing a toe, foot, or leg, follow these guidelines. Inspect your feet daily. Check for cuts, blisters, redness, swelling, or nail problems. Use a magnifying hand mirror to look at the bottom of your feet. You should call your healthcare provider if you notice anything. Bathe your feet in lukewarm water, never hot. Keep your feet clean by washing them daily. Use only lukewarm water, the temperature you would use on a newborn baby. Be gentle when bathing your feet. Wash them using a soft washcloth or sponge. If you can't reach, try using a bath sponge on a handle. Dry by blotting or patting and carefully dry between your toes. Moisturize your feet, but not between your toes. Use a moisturizer daily to keep your skin from itching or cracking. You can also use a bath sponge to apply if you can't reach. Don't moisturize between your toes. That could encourage fungal infections. Cut nails carefully. Cut them straight across and file the edges. Don't cut the nails too short, as this could lead to ingrown toenails. If you have concerns about your nails, consult your doctor. Never treat corns or calluses yourself. No bathroom surgery or medicated pads. Visit your doctor for appropriate treatment. When buying shoes, make sure they fit well. They should be supportive and have heels lower than 2 inches and should not rub or pinch. It's best to shop at a reputable store with knowledgeable staff who can professionally fit your shoes. Buy your shoes in the late afternoon since your feet will swell slightly by then. Wear clean, dry socks. Change them daily. If possible, wear white socks so if you have a cut or sore, the drainage will be easy to see. Consider socks made specifically for patients with diabetes. These socks have extra cushioning and do not have elastics on the top. They are higher than the ankle and are made from fibers that wick away moisture from the skin. Never use a heating pad or hot water bottle on your feet. Wear socks if your feet get cold at night. Shake out your shoes and feel the inside before wearing. Remember, your feet may not be able to feel a pebble or other foreign object, so always inspect your shoes before putting them on. Keep your feet warm and dry. Don't let your feet get wet in the snow or rain. Wear warm socks and shoes in the winter. If you have excessive sweating of your feet, consider using antiperspirant on the soles of your feet. Never walk barefooted, not even at home. Always wear your shoes or slippers. You could step on something and get a scratch or cut. Take care of your diabetes. Keep your blood sugars level under control and eat a healthy diet. Do not smoke. Smoking restricts blood flow in your feet and healing. If you have a wound, it also increases your risk of amputation. Get periodic foot exams. Seeing your podiatrist or medical provider on a regular basis can help prevent foot complications of diabetes. Here are some additional resources. They are also included on the handout. This concludes my presentation. Please take the post test Click on the link below or go to the address at the bottom of the screen. And thank you for watching.